Okay, thank you, Peter. It is a delight and a blessing to be able to work with the CHIP team and also to be able to share with you about CHIP, the CHIP program. Now, just in case anybody is wondering or in fact a little bit worried when we talk about the CHIP program, I want to assure you we're not talking about potato chips or chocolate chips. We are talking about the Comprehensive Health Improvement Program, and that is an evidence-based lifestyle intervention program that has been shown to prevent, to arrest, and also to reverse lifestyle diseases. And so what I'd like to share in the minutes that we have today is the strong evidence base for the CHIP program, some recent innovations that we've made to help make it more accessible and more affordable and an ideal resource for comprehensive health ministry, and also to share the powerful role that it can play in reaching out to our communities to share health, healing and hope with them. So how many of us, just want you to pause for a moment and think how many of us would love to have somebody say to us, "Thank you for giving me my life back again." What's really amazing and humbling for us that work with the CHIP program is that is the key theme of the feedback that we get from people who have been through the program. So there has been 85,000 people have now gone through the CHIP program, and as you can imagine, each of them have their own and unique story. So what I wanted to do was to bring to life a couple of those stories and share them with you this morning, and you will hear not just from participants who have experienced the CHIP program, but also facilitators and those that have been involved in running the program.
And prior to the CHIP program, my life was basically starting to spiral down with one kidney. Lost my kidney 20 years ago. I've had diabetes for over 10 years. I really owe this CHIP program for turning my life around.
Around the world, there is a pandemic issue. Lifestyle diseases are taking over.
When we look at the disease burden in the United States and more around the world, what we see is that it's chronic disease. It's these non-communicable diseases that stay with people for weeks, months, years, even decades.
Being a medical doctor, knowing a lot about medication and drugs, I'm not against conventional medicine. I really feel it has its role, but we know that when it comes to lifestyle, conventional medicine doesn't do very well because we treat the results, we're not actually managing the cause, and this is where CHIP is so incredibly powerful.
Recognized I needed to do something with the diabetes, so I basically got myself involved with the CHIP program. And ever since then, it's been 8 weeks. I've reduced my medications. I was on 4 medications for diabetes. And now, after about 8 weeks, I've reduced my medications down to 2 medications. My numbers have improved dramatically, and the most impressive part is my kidney functions have increased. I feel like I'm getting control of my body back.
What CHIP does, and we have seen this over and over, it builds that bridge. People come into a space where they can be themselves. They can bring their own ideas, their own values, and when they are walking in life together and learning together, they find out that there are more things that they have in common than not. The transformation of lives that I witness, this is priceless. There's nothing that could buy that. And when you are at a graduation and you see all the before and after photos, and you see the smiles and tears, and I can only be thankful for the privilege of being able to facilitate CHIP in my community.
I think we've realised when we look at health and wellness that there's the mental aspect and the spiritual aspect, and if you don't address those issues, often people don't really get as well or improve as much as they should. And that's been the joy of running the CHIP program, that is so balanced the way CHIP is presented.
How we eat, how we exercise, how we manage our stress, how we stay connected to other people and to God. All of these things matter from our health perspective, and so CHIP is a great way to not only treat these lifestyle diseases, these chronic diseases, but also to actually reverse them.
Going to the CHIP program, going through that, made me realise I was actually aligning my values and my actions, which made me feel better about myself.
So what I'd like to tell doctors, if I was standing in front of them right now, don't just throw medication at it. Encourage your patients to follow the CHIP program, because it works. Because it works.
Well, my husband joined the group, which surprised me because he's been a butcher all his life. He actually lost 10 kilos in the first 4 weeks.
What a joy to see someone respond in a way that our medication can't fix.
CHIP can be the connection for people that don't believe that they can do better to become whole person health warriors. And I think that's what CHIP is all about.
These are things that I want for my patients, and to be able to do that with this natural, holistic approach rather than prescribing a pill, to me, it's the best thing in the world.
Everyone's got their struggles, but doing that together, it adds a component of sharing.
My world is better.
Okay, so from the stories of people who have experienced CHIP, let me just scroll up and share about the purpose that CHIP has. So we believe that people were created to live life to the full, but we know that that's not how the story played out, because there was a falling away from that. And so as a result, each of us are living with disease, and by that cancer, heart disease, diabetes, but we're also living with dis-ease, depression, anxiety, loneliness, and distress. And we believe that that is a health injustice. And so CHIP is all about empowering people to take control of their health again and to live life to the full. So I shared earlier that CHIP is a lifestyle intervention program, but let me give you a quick snapshot in 6 key points to give you a better picture of CHIP. So the first point is CHIP is proven. It's been proven to prevent, to arrest and to reverse chronic lifestyle disease. The second point is it's evidence-based. So there are now over 35 published peer-reviewed papers showing the efficacy of CHIP. CHIP also takes a very whole person approach to health. Yes, we're looking at moving more, we're looking at plant-based eating, but we're also looking at building social connectedness and a sense of agency, the ability to make change, and with that comes meaning and hope. CHIP is also multi-systemic. Because it addresses the root cause of disease, it's able to target a wide range of lifestyle diseases. The 5th point is that it's an 18-session program offered over 3 months, and so it's structured to deliver behaviour change. And the 6th point is an important one, and that is that it's outcomes and focus and change focused. So we track the improvements that participants make as they journey through the program and at the completion. And we do that through a health risk analysis and also through blood and biometric analysis. Okay, let's look at one of the 35 published peer-reviewed papers showing the benefit of CHIP. This here on the screen shows the results that were published in the American Journal of Cardiology in 2012. So it shows that those who entered the program at the highest risk saw significant changes in just 30 days. A 3% reduction in body mass, a nearly 20% reduction in LDL, in total cholesterol, 16 in LDL cholesterol, and a huge 44% reduction in triglycerides, and again a nearly 20% reduction in fasting plasma glucose. Those things are risk markers. What's also interesting to see that it actually made a change in terms of people's health status, because we saw a 10% reduction in the number of participants that were classified as having metabolic syndrome. So these are significant changes, and one of the questions that we get is, so what happens after the program finishes? What happens in the longer term? So to answer that question, we'll look at another paper. This one was published in the British Medical Journal Open in 2013. And in this study, the authors looked at the longer term game. They followed up with participants at 49 months, which is nearly 4 years later. And what they found was that those who returned for the assessment and who had gone in with elevated risk factors were able to maintain statistically significant improvements against baseline in most of those biometrics at nearly 4 years later. And in fact, the authors found that 67% of people were still compliant with the key principles of the program. Now, there's another point here, and that is that when the authors looked at those in the study that had gone to a club CHIP program that was offered on a monthly basis in the local church, they found that there was even greater improvements, and in fact 100% of those participants were still compliant with the program. Okay, I'd like to share the results of a couple of case studies where we've worked with organisations who have offered the CHIP program to their employees in pilot programs. The first one is with Lee Health, based in Florida. You may know that that is a large health and hospital system. And the results come from the initial capture of data with 28 participants. So you can see here the significant average loss across the group in weight, LDL and total cholesterol, and also BMI. What you'll also see here is a benefit for the organisation, because they were able to get or gain a net savings in healthcare costs of $1,150 per person. And if you calculate the ROI for that, it's 1:1.8. And in terms of dollar values, it was a $70,000 saving across just 28 participants. Okay, the next study that was done was with Genesis Healthcare, and this was as part of a pilot program with 20 participants. So again, here you can see the average loss across the group in weight, in total cholesterol, and in fasting blood glucose. What I wanted to highlight here is the significant reduction that was made with HbA1c of nearly 20%. That is actually consistent with other research that's been done with Kaiser Permanente and a couple of other corporates as well. So there's a lot that shows the evidence base for the CHIP program. However, there are some other exciting, what I'll call proof points, that I'd also like to share with you. Now, the first of those is that the American College of Lifestyle Medicine actually had this to say about the CHIP program. The clinical results of a large cohort in North America yielded some of the most impressive recorded clinical changes ever in the literature. It's a pretty significant thing to be said. The ACLM now actually use the CHIP program as part of the training on lifestyle medicine for the residents at ACLM. The National Cancer Institute has also certified the CHIP program. And what is new news is that just last month, the British Society of Lifestyle Medicine approved for 27 CPD hours for physicians who have completed the CHIP program. Many of you in the audience, I'm sure, will have heard of Dr. Michael Greger. He's a nutrition physician, probably one of the best known in the world, and has well over 1 million followers on his Nutrition Facts website. He has made the comment, "The best lifestyle program I've seen is the CHIP program." And we also have a number of blue chip companies using the CHIP program for their employee wellness programs, such as MD Anderson Cancer Centre, Cummins Diesel and Providence Healthcare. Okay, I'm excited to share some of the recent innovations that we have as part of the CHIP program. So the story of CHIP started with Dr. Hansdale founding the program over 20 years ago. CHIP 2.0 was started when Sanitarium acquired the CHIP program, as Peter mentioned earlier, and we developed some new evidence-based and contemporary content that was then video streamed through to churches. So we increased the reach of the program fourfold just after doing that, but we did get some feedback. From churches, we heard that it was a bit too expensive and there was pressure in having to download the videos. From corporates, they said, we want to be able to scale the program to reach our large and diverse workforce. And so over the past 18 months, what we have done is to develop what we call CHIP 3.0. And we now have 3 new digital delivery options that can be used. The first one of those is what we call CHIP Hub. It's based on a learning management system and is can be experienced like an online learning program. And so participants join a virtual group and there's a virtual facilitator. The second option is what we call CHIP Drive. So we have the program encrypted onto a digital rights protected memory stick, which people can look at in their own time and then join a facilitated session via Zoom. This then gave us an idea that we could develop that further and something specifically for use in the local church, and I'll talk about that in a moment. One of the other things that we've innovated just recently as part of CHIP 3.0, as we call it, is the CHIP Plus program. So this extends the program by another 18 sessions across another 9 months, and it means that there's now a 12-month program where we can reinforce the behaviour change and hold people and nurture the relationships that we have with them. We are also doing some initial thinking about CHIP 4.0. If you would like to hear more about that, I'd invite you to join our breakout session this afternoon. Okay, in parallel to that, we have also partnered with ADRA Australia to reach lower literacy communities with a program that's called Live More Abundantly. Now, this is based on the CHIP program, the principles of the program, but it's blended with the Reflect methodology. We've seen very positive results with that, and we've moved to next stage of pilot research programs there. Okay, quickly coming back to the CHIP Drive for Health Ministries. The participants here can view the program on the USB stick that I referred to earlier in the setting of the local church with a local facilitator as their host. Now, there are 3 great benefits to this. And the first one is that it addresses the issue of needing to have the internet. Secondly, it addresses the issue of cost. We've been able to lower the cost from what was previously $3.99 to now $99 for people to participate. And we can work in partnership with the GC Health Ministries Department and put additional resources that can be used in the local church. So these innovations make the program more accessible, more affordable and extendable. Just as we look to come to a close, to date, as I've mentioned, there's been 85,000 people go through the program. Our goal is to double that reach in the next 3 years, and over the next 10 years to have reached and touched the lives of 10 million people. I hope that you've been able to see that CHIP is a powerful resource for health ministry. It helps to change people's lives. It's evidence-based. It can lower costs for individuals and also for organisations. And it supports comprehensive health ministry in the local church. So I would like to invite you to consider becoming, if you're not already, part of the CHIP movement and to help us change the lives of 10 million people over the next 10 years. You can help to address the health injustice that we've talked about, that billions of people around the globe are facing, with a program that is fully consistent with the health message of the Church. So coming back to the question that we asked at the beginning, would you like to have someone say to you, "Thank you for giving me my life back again"? I invite you to join the CHIP movement and hear those words. Thank you.